This is Dr. Gary Wallach speaking to you now about plantar fasciitis. Plantar fasciitis is very often called heel pain. Sometimes people call it heel spurs, but the pain is actually in a band on the bottom of the foot called the plantar fascia. What most people experience is pain when they first get up in the morning. We call this rest pain. As the day progresses, it may subside only to return later on. The heel hurts and then the entire foot will ache as well. The problem is treated in our hands with a three-pronged approach: cortisone injection, physical therapy, and foot orthotics, devices devised to support the foot appropriately. And in our hands, this problem is resolved normally within 1 to 2 months at the most after initiation of treatment. And there's an 85 to 90% cure rate with the above treatments as stated. However, there is a population that the problem does not go away with this kind of treatment. Usually these folks have the problem for a long time. In that case, there's a procedure known as the endoscopic assisted plantar fascia release. Depicted here on the left side in the diagram, that's the plantar fascia, and this actually is released quite effectively and very easily. With this procedure, there's minimally invasiveness to the body. There's no downtime. You're up and walking the next day. It works very effectively. We call the procedure, again, the EPF, endoscopic plantar fascia release. And this is what it is. Look on the left. There's a little diagram with an arrow pointing to the plantar fascia. Now, on the right side is you're actually looking through the endoscope at that same portion of the plantar fascia. And what we do is we make a tiny little slit in it. That slit is, again, depicted on the left by the arrow. It represents only 10 millimeters. And by releasing that 10 millimeters, the pain is alleviated. You're in shoes the next day. You're up and walking. Again, this is minimally invasive, very effective for alleviating the pain in the bottom of the foot, and it is quite well accepted.